Good morning, Mrs. Morrow. I'm back again. My name's Sarah Ritchie. I'm going to be your student nurse. We're just going to be going through a little bit of patient education about using a straight cath at home. Before I get started, can you tell me your name and date of birth? All right, Josephine Morrow, born February 1st, 1966. That does match my records. So Mrs. Morrow, I know I came in earlier and I performed the straight cath on you. But I just wanted to give you a little bit, some education, and we do have some pamphlets for you to take home that has a detailed list of the steps for you. So the first thing you're going to want to do is get all of your instruments set up. Maybe on your sink in your bathroom counter is the place most people feel more comfortable, because you do want to be, the bathroom, it is associated with, draining your bladder. And so this is something that can really help you feel more relaxed and not get so uncomfortable when you're performing this at home. And so the first thing, you're going to set up your instruments on your counter. You're going to have a catheter. You want some clean gloves, maybe some soap, and something to drain your bladder in, whether that's going to be the toilet or a basin or something you might have at home. And maybe a mirror. Also, a lot of people say that a mirror does help them with the catheter insertion. So what you're going to want to do is you're going to get into a comfortable position for you, usually with your knees together, with your heels of your feet together and your legs spread, or maybe some type of squatting position. And you're going to clean your vagina. You're going to want to go on the outside first and throw away the cotton balls as you use them, and then go down the middle from the top of your vagina down to around your rectum. And so we recommend using here we use betadine. There's things like HiPoCleanse that has a chlorhexidine cleaning solution in them. I'm sure that will give you some type of cleaning product on the way home, because some can be very agitating to your area, and we don't want to cause any more chance of a UTI or yeast infections or things like that while you're doing this at home. And so after you clean, you can get you change your gloves and get ready to insert your catheter. And this is just a simple in and out catheter, is what people in healthcare facilities like to call them, a straight cath. And so there's no balloon port. You just kind of hold it there and wait for your bladder to drain. You will insert the catheter until you see urine that comes out. At that point, you can advance 2.5 centimeters to make sure that you're fully in the bladder. And you're just going to wait until you no longer have urine coming out of the catheter, and at which point you can remove. And I know sometimes we can forget about this, but make sure you're using lots of lubricant. That helps with the insertion of the catheter, make it a little bit less painful for you. And so once you're done, you can just get all your supplies cleaned up. A lot of the time the catheters are reusable ones that you can clean. They're plastic or silicone based. But some people do opt to do the non-reusable, and they use a new one every time. And so you really just want to make sure to keep in mind that you want to keep this procedure as clean as possible, because you are chancing the risk of UTIs every time you insert a catheter. And so just make sure you're really cleaning that area, that your catheter is very clean, that when you remove it, you're cleaning up your perineal area again. And I think that's just about it, Mrs. Morrow. So do you have any more questions for me before I leave? All right, Mrs. Morrow, I'm just going to lower your bed down a little bit, get you a little bit more comfortable. And we will be back in soon with your discharge papers. All right, Mrs. Morrow, you have a great day.